There is a moment that happens every single morning in your bedroom. It lasts less than 30 seconds. And for millions of Americans over the age of 60, that moment is quietly doing more damage to their heart than anything they ate yesterday, anything they skipped at the gym, or anything their doctor found at their last checkup. It is not dramatic. There is no warning sound, no pain, no signal of any kind. It feels like nothing, because it is nothing, just the most ordinary, automatic, completely unremarkable action of your entire day. And that is exactly what makes it so dangerous. Your cardiologist checks your cholesterol. Your physician monitors your blood pressure at rest. Your pharmacist reviews your medication schedule. And none of them, not one, is looking at what your cardiovascular system is doing the 30 seconds after your alarm goes off. But some of the most serious cardiac researchers in the world are. And what they have found is deeply uncomfortable. Fatal cardiac events, heart attacks, strokes, sudden cardiac death, are not randomly distributed across the 24 hours of the day. They cluster, they peak, and they peak hard in one specific window, the first 3 hours after waking, not slightly elevated, not marginally higher, 3 times more likely to occur in that window than at any other comparable period during the day. A Harvard-linked analysis calculated the relative risk at threefold, and that number has been replicated across cardiovascular research for decades, 3 times. And the reason that window is so dangerous, the real reason, the biological reason that most people have never been told, has almost nothing to do with what you eat for breakfast or whether you take your medication on time. It has everything to do with a chain reaction that begins the instant your brain starts surfacing from sleep. A chain reaction that most people over 60 are, without knowing it, accelerating rather than managing. I am going to walk you through exactly what is happening inside your body during those first 30 seconds of the day. I am going to explain the 3 invisible biological factors that converge in that narrow window and turn a routine Tuesday morning into the highest risk cardiovascular moment of your entire day. And I am going to give you a 4-step morning sequence. It takes less than 2 minutes, costs absolutely nothing, requires no equipment, no supplements, no changes to your medication or your diet. That works with your body's biology instead of against it. Stay with me through this entire video, because the information in the second half, specifically the part about a protein that peaks in your bloodstream at exactly 6:30 in the morning, is a piece that most surprises even people who think they already know a lot about heart health. This channel exists for one specific group of people, adults over 60. My focus is always the same, not just understanding disease after it arrives, but learning to read the signals your body sends long before the damage becomes visible. Before we go further, I want to hear from you. Where are you watching from today? Drop your city, your state, your country in the comments below. I read every single one, and it genuinely helps me understand who is part of this community. Let us start at the beginning. Let us start with what your body is actually doing the moments before and after you wake up, because this is a part that almost nobody explains clearly, and without it, nothing else I am about to tell you will make complete sense. Most people think of sleep as a single, consistent state. You close your eyes, your body rests, you wake up. Simple. The physiology is far more complex than that. During the deepest phases of sleep, your nervous system shifts into something I call recovery mode. Your heart rate slows to its daily minimum. Your blood pressure drops, sometimes 10 to 20 points below your typical waking reading. Your stress hormone levels are suppressed. Your blood vessels are relaxed and gently dilated. Your heart, which works every single second of every single day without rest, is getting its best opportunity for genuine recovery. This is one of the most important things sleep does for your cardiovascular system. And most people have no idea it is happening. But here is what changes as your body begins to prepare for waking. In the final hours of sleep, your body's internal clock, scientists call it circadian rhythm, begins a slow, quiet biological buildup. It is your body's way of anticipating the demands that come with being awake and upright and moving through the world. Cortisol, your primary stress hormone, starts a gradual pre-dawn rise, and then your alarm sounds, and everything accelerates at once. Research published in peer-reviewed journals and confirmed repeatedly in human circadian studies shows that cortisol levels spike by an average of 50% within just 30 to 45 minutes of opening your eyes. The range documented across studies is 38 to 75%. Scientists have given this event a name, the cortisol awakening response. And it is one of the most powerful, rapid hormonal events your body produces in any 24-hour period. At the same time, your adrenal glands are releasing epinephrine, what most people call adrenaline. Together, these two hormones flood your bloodstream in the minutes immediately after waking. Now, these hormones are not a mistake of biology. They serve a real purpose. They raise your heart rate. They increase your blood pressure. They constrict your blood vessels slightly to push more circulation toward your brain and your muscles, preparing your body to go from horizontal stillness to vertical activity. For a 40-year-old with elastic, flexible arterial walls and clean blood vessels, that system works beautifully. The surge comes, the body adapts smoothly, and the whole transition happens without incident. But after 60, 3 specific things have changed. And those 3 changes are what transform a normal biological event into a genuine cardiovascular risk. Factor 1, arterial stiffness. Your arteries are not rigid pipes. They are living tissue, and in younger adults, they are supple and elastic, designed to absorb and buffer pressure waves that come with every heartbeat. As we age, the elastic tissue in arterial walls gradually degrades. Collagen accumulates. The walls become measurably stiffer. This is not a disease. It is a natural aspect of aging, but its consequences in the morning are significant. A stiff artery cannot absorb a sudden pressure, surge the way a flexible one does. The same wave of hormonal pressure that a younger cardiovascular system barely registers can translate into a dramatic and sudden spike in blood pressure in someone over 60. When that spike is already being driven by a 50% cortisol surge in the first 30 minutes of the morning, the stress on the arterial wall is not trivial. Factor 2, silent plaque. This is a factor that most people find most unsettling, and I want to address it carefully. Most people with moderate plaque buildup in their arterial walls have no idea it is there. Not because their doctors are missing it, but because the standard tools of clinical monitoring, annual checkups, routine EKG, resting blood pressure readings, are not designed to detect the kind of quiet, stable, asymptomatic plaque that sits in arterial walls for years without causing symptoms. You can have a completely clean stress test, a perfectly normal echocardiogram, and a reassuring annual physical, and still have plaque deposits in your coronary arteries that you know nothing about. That is not a failure of medicine. That is simply the nature of how plaque accumulates. Here is why it matters for the morning specifically. Stable plaque, the kind that has been quietly sitting in an arterial wall for years without causing a problem, has a surface. That surface can crack under sudden mechanical stress. And when the surface of plaque deposit cracks, the body responds immediately and aggressively, as though it is responding to an injury. It sends platelet. It initiates clotting. It begins building a clot at the site of the crack. A clot in a coronary artery is a heart attack. A clot that breaks free and travels to the brain is a stroke. The person experiencing this often had no prior symptoms. Their last checkup gave no warning. The plaque was invisible until a sudden pressure surge cracked its surface on an ordinary Tuesday morning. Factor 3, blood viscosity, the factor nobody talks about. This third factor operates quietly in the background, and it may be the one most people have never heard of at all. Think about what happens to your body overnight. You lie still for 6 to 8 hours. You breathe continuously. If you breathe through your mouth at any point, which studies suggest most people do, at least some of the time, especially sleeping on the back or with any nasal congestion, you are losing moisture with every exhale. Research shows that water loss through breathing is 42% greater in mouth breathers than in nose breathers. But even consistent nose breathing over a full night causes meaningful fluid loss. The body loses an estimated half a liter to a full liter of fluid overnight through respiration and insensible perspiration alone, with zero intake to replace it. The result: by the time your alarm sounds, your blood plasma volume has quietly decreased. Your blood has become measurably thicker and more viscous than it was when you fell asleep, and thicker blood is harder to pump. Your heart has to generate more pressure with each beat to move that thicker fluid through the same vessel. This elevation in blood viscosity in the early morning hours has been documented in medical research since the 1960s and was confirmed in a review published in Circulation Research, the Journal of the American Heart Association. Now here is where it becomes even more specific and even more troubling. The proteins responsible for initiating clot formation in your body follow their own circadian rhythm. Chief among them is a protein with a long name, plasminogen activator inhibitor 1, which researchers abbreviate as PI1. This protein does something very specific. It prevents your body from dissolving clots once they form. It essentially turns off your natural clot clearing system. And PAI-1 peaks in your bloodstream at approximately 6:30 in the morning. 6:30, precisely at the center of the highest risk cardiac window of the entire day. This is not a coincidence. It is a biological pattern, likely protective in an ancient context, when waking meant immediate physical demands and potential injury. But in the context of arterial stiffness, vulnerable plaque, and a sudden morning pressure surge, it becomes one more factor loading an already dangerous equation. So let us review what is happening simultaneously in your body in the first 30 seconds after your alarm sounds. Your cortisol and adrenaline are surging, driving up heart rate and blood pressure rapidly. Your arterial walls are stiffer than they were at 40, less able to absorb that pressure spike. Your blood is thicker than it will be at any other point today, making your heart work harder to move it. Your clotting proteins are at their peak concentration, primed to form and hold clots at the first opportunity. And all of this is already in motion before you have made a single conscious decision about your morning. And then most people do the one thing that takes every single one of those factors and makes them significantly worse. They sit straight up and swing their legs over the side of the bed in one fast motion. That is the 25-second mistake. And I want to explain precisely what it does to your cardiovascular system. Part 3, what that movement actually does to your heart. When you're lying flat, your blood is distributed relatively evenly throughout your body. Gravity is not a significant variable. Your heart pumps, blood circulates. Everything flows with reasonable efficiency. The moment you go vertical, and especially if you do it quickly, gravity immediately pulls a significant volume of blood downward. Blood pools in the large veins of your legs and lower abdomen. Circulation to your brain decreases rapidly. Blood pressure at the level of your head drops suddenly. In a healthy younger cardiovascular system, a reflex called the baroreceptor reflex restores this almost instantly. Sensors in your arterial walls detect the pressure drop, signal the heart to beat faster and harder, signal the blood vessels to constrict, and pressure is restored in 2 to 3 seconds. In adults over 60, that reflex is slower. The signaling takes longer. The vessels respond less quickly, and before that compensation completes, blood pressure can drop 15, 20, sometimes 30 points within just seconds of standing. You may know this feeling exactly. That gray, foggy, slightly unsteady sensation right when you first get out of bed. Many people over 60 experience it every single morning and have quietly filed it away as just a normal part of aging. It is not normal. It has a clinical name, orthostatic hypotension. Research published in peer-reviewed literature defines it as a drop of 20 millimeters of mercury or more in systolic blood pressure within 3 minutes of standing. Studies indicate it affects approximately 20 to 30% of adults over 70, meaning right now, as you watch this, 1 in 4 or 5 of you may be experiencing this every morning without understanding what it means for your heart. Here is where the danger concentrates. When your blood pressure drops suddenly after standing, your heart does not sit quietly and wait for the problem to resolve itself. It compensates aggressively. It receives an emergency signal to increase its output, to pump faster and harder to restore circulation to the brain. That compensatory spike, layered on top of the cortisol surge, layered on top of stiffer arterial walls, layered on top of thicker blood that is already primed clot, is precisely where vulnerable hearts break down. The research on this is consistent. Studies tracking the timing of acute cardiac events show a pronounced cluster between 6 and 10 in the morning. Not because morning is inherently dangerous in some vague, general way, but because of the specific documented biological convergence, triggered and worsened by the single act of standing up too fast. The 25-second mistake does not feel dangerous. That is exactly why it is dangerous. If this is the first time anyone has explained what that morning dizziness actually means for your heart, hit the like button right now. You just learned something your annual checkup almost certainly never covered. I want to tell you about a patient. I will call him Raymond. Raymond was 71 years old, retired engineer, methodical, disciplined, not a man who took his health casually. He wore a continuous glucose monitor to track his blood sugar trends. He logged his blood pressure readings twice a day. He had been on a statin and a low-dose beta blocker for several years. His most recent echocardiogram had been, in his cardiologist's words, reassuring. His stress test from the prior year showed no significant ischemia. By every standard clinical measure, Raymond was managing his cardiovascular risk responsibly and effectively. He woke up on an ordinary morning, silenced his phone alarm, and sat straight up. He was in his kitchen making coffee. Within 3 minutes of waking, his wife heard something and found him leaning against the counter, confused, sweating. She called for help immediately. He was in the hospital within the hour. What Raymond experienced was not a massive, life-ending cardiac event. It was an acute coronary syndrome, a partial blockage caused by a ruptured plaque deposit, and a clot that formed around it. He recovered, but when I sat with him afterward and walked carefully through the morning timeline, everything fit the pattern exactly. The alarm, the immediate fast sit-up, the quick movement to the kitchen, stiffened arteries, elevated morning blood viscosity, a cortisol surge that spiked his pressure at precisely the moment his clotting proteins were at their daily peak, a compensatory cardiac spike that cracked a plaque deposit that had been sitting quietly in his arterial wall for years, never announcing itself, never showing up on a test, never causing a symptom. What haunted Raymond, and what I think will stay with you, is that nothing about his clinical profile had suggested that any particular morning was dangerous for him specifically. Nobody had ever asked about his morning routine. Nobody had ever told him to slow down for the first 60 seconds of the day. Nobody had explained that the transition from sleep to standing is itself a cardiovascular event, and that how you manage those 25 seconds matters independently of everything else you do for your heart. We made changes before Raymond went home. Simple ones, free ones. At his 6-month follow-up, his morning blood pressure log showed a noticeably more stable pattern. The dizziness he had experienced every morning for years and simply ignored, gone. He asked me a question I have been asked many times in that context. Why did anyone think to mention this before? The honest answer is that most of what we know about morning cardiac risk lives in research journals and cardiology conference presentations. It does not always make it into the 15-minute annual checkup. That gap between what the research actually shows and what actually reaches you is part of why I make these videos. If you want to be the person in your family who knows this before it matters, subscribe now. Every single week, I bring you one thing your checkup did not cover. Now I want to bring everything together into something practical, something you can begin tomorrow morning. I call it the 4-point waking protocol. It takes 90 seconds to 2 minutes total. No equipment, no cost, no supplements, no changes to your medication, your diet, or your evening routine. This is a sequence designed to work with your body's biology instead of accelerating the damage. Point 1. The stillness breath. 15 seconds. The moment your alarm sounds, do not move. This is not a suggestion. In the context of everything I have just explained, this is a cardiovascular instruction. Stay flat. Your brain is about to receive its first cortisol and adrenaline wave of the day. The single most effective thing you can do in the next 15 seconds is activate the calming branch of your nervous system before that wave fully peaks. Take 4 slow, deliberate breaths while you are still lying flat. Inhale through your nose for a count of 4. Hold for 1 count. Exhale through your mouth for a count of 6. That extended exhale, longer than the inhale, is not incidental. It directly stimulates the vagus nerve, which is a primary pathway through which your body applies the brakes to a stress response. A study published in Scientific Reports found that slow, deep breathing with an extended exhale increased vagal tone in both younger and older adults. And notably, the benefit was significantly greater in the older group. Your nervous system responds to this. The research confirms it. For breaths, 15 seconds, still flat on your back, and you are activating your body's calming system right at the moment the cortisol wave is cresting, before it has a chance to drive your heart rate and blood pressure into that dangerous morning spike. That is your first protection. If you are still with me and finding this valuable, drop the number 1 in the comments. It helps me know you are here and following along. Point 2. Drink the water. 20 seconds before you sit up, while you're still lying down or just beginning to roll to your side. Reach for the glass of water you placed on your nightstand the night before. Room temperature water. Not ice cold. Not coffee. Not juice. There's a specific reason for the timing here. Once you are upright, the cardiovascular cascade has already begun. Drinking water before that transition gives your system a small but physiologically meaningful buffer. It begins to thin the blood slightly, starts restoring plasma volume, and reduces the concentration of clotting factors before your heart is asked to work against gravity. The research on morning hydration in older adults consistently shows measurable reductions in blood viscosity and platelet activity, when fluids are placed promptly after waking. One glass does not fully replace the fluid lost overnight, but it begins the process at the exact moment when your cardiovascular system needs it most. Tonight, before you sleep, fill a glass of water and put it on your nightstand. That single action tonight changes tomorrow morning's cardiovascular risk profile. Point 3. The graduated transition, 45 to 60 seconds. Now it is time to move, but slowly and in stages. First, roll to your side. Do not sit straight up from flat. Rolling to your side first creates a far less abrupt pressure change than a direct upright sit. From your side, push yourself to sitting using your arms. Let your feet hang over the edge of the bed. Now, before you stand, do this. Rotate your ankles 10 slow circles in each direction. This is not a stretch for its own sake. Your calf muscles are the most powerful venous pump in your lower body. When you contract them, even through the simple motion of ankle rotation, they actively push-pull blood from your legs back upward toward your heart, beginning to restore the circulation volume your brain is about to need when you stand. A study examining ankle movement before standing found that just 1 minute of ankle flexion reduced the blood pressure drop upon rising from a median of 17.5 millimeters of mercury down to just 1 millimeter of mercury in patients with orthostatic hypotension. 1 minute of ankle movement. That is what this step is doing for your circulation. Sit on the edge of the bed for a full 30 seconds before you stand. If you regularly experience that gray, foggy, dizzy feeling when you first get up in the morning, the sitting pause is directly targeting that problem. You are giving your baroreceptors time to calibrate, your vessels time to begin adjusting before you ask your heart to fully compensate for the gravitational shift. Then stand slowly, pressing up through your legs. Once upright, pause. Stand still for 10 full seconds before you take your first step. That 10-second pause is not excessive caution. It is the final stage of the transition, giving your cardiovascular system the moment it needs to confirm that pressure is stable before you begin moving through your day. Point 4. The morning check, 30 seconds. This fourth point is less about what you do and more about what you notice. As you're sitting on the edge of bed, during that 30-second pause, briefly pay attention to how you feel. Any chest heaviness that was not there last night? Any unusual shortness of breath? Any sensation of pressure or discomfort that radiates into your jaw, your shoulder, your arm? Any pounding heartbeat that feels different from ordinary morning grogginess? Most mornings, you will notice nothing worth flagging, and that unremarkable baseline is valuable information. But building a brief habit of conscious self-check into this 2-minute morning window means that on the morning when something is different, when your body tries to send a signal that deserves attention, you are already listening. You have not rushed past that warning on your way to the coffee machine. If you have made it this far and you are getting real value from this video, type the number 3 in the comments. It is a simple way to let me know you are here. I want to pause here for a specific group because there is an additional layer to this conversation that applies directly to a significant number of people over 60. If you are taking a beta blocker for blood pressure, heart rhythm, or heart failure, you need to understand something about how that medication interacts with the morning transition. Beta blockers work by blunting your body's response to adrenaline. That is the mechanism that makes them effective for controlling heart rate and blood pressure. But they also blunt your heart's ability to accelerate in response to the postural pressure drop that happens when you stand up. In other words, the compensatory spike that normally restores circulation to your brain when you go vertical. Beta blockers slow that response down. Research from the Irish longitudinal study on aging found that beta blocker use was associated with more than twice the likelihood of initial orthostatic hypotension and more than 3 times the likelihood of sustained orthostatic hypotension compared to individuals not on the medication. More than 3 times. This is not a reason to stop taking your medication. Beta blockers are prescribed for important, often life-preserving reasons. But it does mean that if you're on a beta blocker, the graduated transition in point 3 is not optional for you. It is essential. Your heart's automatic compensatory response is being modulated by your medication. You need to give your system more time, not less, before you move to fully upright. If you experience regular morning dizziness and you take a beta blocker, bring it up specifically at your next appointment. Ask your physician whether your dosing schedule or dose level may be contributing to your morning symptom. That is a specific, productive conversation to have, and it begins with knowing that the morning transition is worth examining. let me bring everything full circle. The morning is not randomly dangerous. It is specifically dangerous for specific, documented, biological reasons that compound on each other inside a very narrow window of time. A hormonal surge that stresses arterial walls, they're already less elastic than they once were. A postural pressure drop that forces the heart to compensate aggressively at the exact moment when clotting proteins are at their daily peak. Blood that is thicker, more viscous, and more prone to forming clots than at any other point in the 24-hour day. And a deeply ordinary habit, sitting straight up and standing immediately, that takes all three of those factors and accelerates every one of them simultaneously. The 4-point waking protocol does not require medication. It does not require a gym. It does not require you to change your diet, your evening routine, or your medical regimen. It requires you to put a glass of water on your nightstand tonight. It requires 4 slow breaths before you move, a gentle roll to your side, 30 seconds sitting at the edge of the bed with your ankles rotating, and a slow, deliberate stand with a 10-second pause before your first step. 90 seconds. That is an investment. 90 seconds that directly address the 3 biological factors, converging to make the first 30 minutes of your morning the highest risk cardiovascular window of your entire day. I want to ask you one question before you go. When you get out of bed in the morning, how fast do you move from lying flat to standing? Under 5 seconds? Under 10? Take your best guess and write it in the comments below. I read every single one, and the range of answers tells me exactly how many people are living inside that danger window without knowing it. If this video gave you something you did not have before, share it. Text it to someone you care about. Put it somewhere a person over 60 in your life will find it, because the people who need this information most are not searching for it. They do not know to search for it. Subscribe if you have not already. Every week I bring you exactly this specific research-grounded information about your body after 60 that consistently gets crowded out in a 15-minute doctor's visit. Take care of your heart. It has been working for you without rest, without complaint, without a single day off for every year of your life. Give it a better morning, starting tomorrow.